The case study that I chose for this project was One Small Cut That Killed. In this case study, a farmer comes in after cutting himself on some wire. He comes in and the doctor just evaluates him and says that he only has some minor cuts and bruises and a sprained ankle and sends the patient home with an air cast and tells him to take some ibuprofen and just to take it easy for a few days. A couple days later, the patient is seen at the same hospital in the emergency room and he is found with an infection and he later dies. The patient's family wants answers, and the hospital wants for the physician to apologize to the family. The physician is afraid that if she apologizes, that she will be in trouble legally with the family and also be in trouble with her employer. My thinking strategies before I even started this paper was this is going to be easy. The physician just needs to apologize. The only thing I needed was to find the research to back up as to why it would be important for this physician to do so. I believe every step of the research project was relevant in coming out with my conclusion. I think the part that helped me the most was the anointed bibliography. That was where we had to find two sources, and I think finding those two sources early on helped me get a jump start to the finishing project. I think the most important thing is just having information to back up anything that you're talking about, whether it's a research paper or if it's a topic at work, or maybe it's just something that you want to change about the office that you're working in. The more information you have to back yourself up, the better chances is of you getting your point across or actually making a change go through. Um, I think the most important thing with working on a task is your time management, making sure that you're giving yourself enough time to hit every point that you want to come across. Like you want to have all the information that you need and be able to fully explain that information. I think in this paper, everything was clear cut. If you do something, whether it's intentionally or non intentionally in the healthcare field, you have to apologize. You don't want for the patient to feel as that they're not important, which is the whole main reason of you go to the hospital. You go there for your care to make sure you get the best care. And that's where my three capabilities come into place. You have to have tolerance for patients, whether they are irate or if they're feeling bad, or sometimes you just have to listen to them. You have to tolerate them. The second thing is communication. Communication is very important, and it was very important in this case. The doctor had to talk to this family. There was no way of getting around that. That's more. She would have more likely got a lawsuit had she not communicated with the family. And then the third part would be attitude. Attitude is very important, not only in this case or during school or in work. It's just period. That's the only way you could really get your point across. There's a million ways to say things, but if your attitude is not a bad attitude, they're more likely to take in what you're saying. Hopefully this made sense to you guys and it was a good job. Thank you.